Are we becoming a country fearful, or are we allowing those to invoke fear in us to profit? That's a question we must ask with the COVID-19. If you look at the numbers, 3 million people in California was infected. Out of those 3 million people, 38,000, a little bit over 30,000 died. I say this because that's 1%, only 1% of the infected rate. Yes, one life dead is obviously tragedy. I'm not belittling that. But we must think about, are there people trying to profit by invoking fear? So there's a doctor that I'm gonna let you listen to, and listen to what he says about the rate of death. He's saying that the rate is actually decreasing, even though the infection rate is increasing. Take a listen to the video. Judge for yourself.
It seems as though they're having about a 70%-ish increase in terms of how contagious this virus is. And what we did learn from our understanding of virology is that, generally speaking, viruses will tend to, as they kind of continue on, get a little less lethal. And we're starting to see that. So I can certainly tell you from my own experience. I work at 3 different hospitals in New York City. I'm starting to see, again, the numbers are rising. We're at around 6.2% ish in the state and in the city specifically. And I'm seeing about a third to half of my patients have the virus. So we're starting to see the numbers go up in terms of what's contagious. But what we are also seeing is that it's less lethal, which is a good sign. And it's a positive sign for us because whereas before, every patient that was in the intensive care unit was on a ventilator pretty much almost 100%. We're now seeing it at a rate of about 60%. So where it's transitioning is from a very lethal virus to something that's a little bit more to be admitted to the regular floors of our medicine units. Then the challenge with that is still we can see a number of folks and hospital systems get overwhelmed by having those large numbers there. And so this certainly provides concern for us about what's happening in the UK. Thankfully, it's from my understanding, in terms of talking with my friends and my experts, that our vaccines should continue to treat this disease process.
Well, I have noticed that friends and family that have caught the COVID-19 have, people, friends that have immune compromised systems, diabetes, all the things that will make them more susceptible to death has actually came through. And some of them was just asymptomatic. So could the doctor be right? Or could it just be the treatment is better? Could it be that we have a better handle on it? Um, like I said, we cannot allow the fear overcome our thinking, or could it be people are still trying to invoke fear in order to profit? Because I've noticed that a lot of news stations do not talk about this aspect. So tell me what your thoughts are. Let me know. Thanks.